Good evening. Good to have you with us this Friday night on the Urban Debate, and we continue with our special focus on the coronavirus. Viewers, over the next 2 hours, we are going to bring about issues and important stories that matter to you like we always do. Quick look at what's actually lined up tonight on the Urban Debate. To our story number one, that's what we're going to discuss in just a minute from now, is the story about Mumbai. Has Mumbai become India's biggest challenge in the war against coronavirus? And we'll tell you why. We'll get experts to talk about just what are the hurdles when it comes to the city of Mumbai. At 8:35, then the next conversation will be about plasma therapy. Yes, the Delhi Chief Minister today said that it's now being tried on patients, and 2 of them have actually also recovered. More and more states are now beginning with their plasma therapy trial. One more time, we'll try and understand what this process is, what does it do, and can it be helpful. And then we will also tell you and do an entire explanation on the latest news that's come in from the investment market. Now, Franklin Templeton has decided to wind up 6 of its debt schemes. What does it mean for investors? Will they get their money back? Should there be any concern at all, not just for Franklin Templeton investors, but others who have put money in debt schemes as well? And after that, tonight, viewers, as we finish 1 month of lockdown, and we still have some more days to go at least, we don't know when things are going to change for the better. We will get you top influencers, celebrities, to have a conversation here, blow off some steam, talk about how the past 1 month has been, what can we do to flatten the boredom curve. So that's going to be a very special conversation here at 9 p.m. tonight. But first up, let's go across and put the spotlight on Mumbai. Now, 4,232 cases and 168 deaths, which is why maximum focus should be given to the maximum city right now, viewers. The city with the maximum number of cases must be spoken about. And I'm not sitting here to raise any alarm bells, but we want to have a conversation about the level of preparedness, the kind of strategy that is required, just how long could this last, how many beds, how many ventilators, how many quarantine centers, medical staff, all of this put together. What should be the level of preparation for the city of Mumbai? Now, while the rest of the country may be looking at a lockdown lifting up on May 3rd, can we expect that for people living in Mumbai? Here is how Mumbai's corona curve has really moved. On March 27th, we had 51 cases in the city of Mumbai. By March 31st, the cases had gone up to 93. By April 8th, the cases had gone up to 642. By April 15th, they had then gone up to 1,756. By April 22nd, the cases had gone up to 3,451. And now, in a single day, Mumbai has recorded over 500 cases. This is the single largest spike that we've seen on a daily basis, the daily number of cases that get reported as far as the city of Mumbai is concerned. So here is why I believe Mumbai is India's biggest challenge. 522 COVID cases, the single largest spike that took place on Thursday. 65% of the total COVID cases are in Maharashtra. 65% of India's cases, 65% of the Maharashtra's cases are in Mumbai. And 18% of India's cases are in Mumbai. Similarly, 60% of the lives that have been lost in Maharashtra were from Mumbai. 60% of the deaths in Maharashtra were from Mumbai. And 23.4% of the deaths that the country has registered have been from Mumbai, which is a large number. To have 18% of the national cases just in one city. And of course, we have been talking about the level of preparation, large number of doctors, beds, quarantine centers. What more needs to be done? That's the big question. Let's say good evening to our panelists joining us right now. Dr. Jaleel Parker, Senior Consultant with Leelavati Hospital. Dr. Gautam Bansali, Consultant Physician with Bombay Hospital and a member of the Maharashtra Task Force. Dr. Lancelot Pinto, he's the Consultant Pulmonologist with the Hinduja Hospital in Mumbai. And I've also got Dr. Lipika Nanda, Vice President for Multi-Sectoral Planning and Public Health with the Public Health Foundation of India. Good evening to all of you. Good to have you with us. Dr. Bansali, let's start with you. Since you're part of the task force and, of course, for the task force as well. One of the big focus areas is Mumbai. What is largely now the strategy, considering that we are seeing a significant number of cases on a daily basis?
Yeah. Hello. Hello. Tanvi, can you hear me?
Yes, Dr. Bansali. Yes, I can.
Yeah. Yeah. Tanvi, first of all, I will thanks to you that you are always. Hello. Hello.
Yes, go ahead, please. We can hear you.
Yeah. Yeah. So, Tanvi, if you see the first of all, I am telling you one thing that the number of cases increasing in city like Mumbai. If you see the demography, repeatedly I am telling so many people that demography and of the Mumbai is totally different of the from the rest of the city of the country. See, here we have the densely populated houses are there. So, if you see that there are a lot of pockets like Dharavi is there, Varli Kolivada is there, Sayan Kolivada is there, where in a room like a 6 by 10 room, there are 10 people are staying in that room. Because of that, it's very tough to get isolation. It's very tough for us to maintain that physical distancing in between the peoples. Now, the second thing, that's why number of cases is increasing. Second thing, number of tests, if you see in the rest of the country and Mumbai, number of tests we have increased. As now we have the highest cases, highest number of tests in the city. But one good thing, if you can see that, good thing is that we have maximum cases which are asymptomatic. Definitely, they are positive, but they are the asymptomatic, which is a good news for the city like Mumbai, or which is a good news for the country. Now, the as far as preparation is concerned, yes, we are preparing for the worst situation. Like if that number of cases gone up to like 30, 40,000, chances of that is very minimal. But if the cases will go up to that 30, 40,000, we have enough bed capacity in this city. We have enough dedicated COVID centers. We have enough areas. We have enough isolation ward also. So to me, we should not be panicky at all that cases are increasing. That's why we should be panicky. No, no need to be panicky at all. We have enough sources, enough ventilator, enough ICUs. And if you see the death rate and all these things, critical patients are hardly less than 10% only. So we don't need as of now that much ventilator. Hardly we need bed which is having oxygen supply and for the patient who is symptomatic COVID positive patients. For that, we have enough bed capacity in city like Mumbai.
Mhm. Okay, that's good to know. Let me just go across to Dr. Parker. Dr. Parker, if we look at specific pockets, there is one pocket, say for example, of Worli, Lower Parel, Prabha Devi, and Mahalakshmi. That ward has seen about 534 cases. There is another pocket of Andheri, Parla, and Juhu that's seen over 300 cases. Similarly, the Mazgaon, Nagpada, Baikala area has seen 421 cases. Do you think going forward we will have to define a strategy that focuses on specific areas and spots while the rest of the city may get some kind of relief?
Tanvi, let me start from the beginning. 70% of our population in the state of Maharashtra is all in the slums. Okay, now because we had nearly more than a month of isolation, everybody is supposed to remain in their houses. It is very difficult to manage this, especially in the slums. These pockets that you're talking about is, of course, in the slums, where otherwise on a normal working day, if in a 100 feet room, if there are 12 people, 6 are doing day shifts, 6 are doing night shifts. But now, because of everything that has been struck down, all the 12 are in that small room. So are we really achieving the isolation benefits? I think it's quite questionable. Having said that, you know, people, ourselves, all of us, rather, we have made it very alarming that this is such a scary disease that all are going to die. Now, that is what has happened with the mindset of the whole population at large. What has actually happened is, if I say that 70% of the population, if they are exposed to this virus. Most of them will be asymptomatic. I've been saying that time and again. Another 15% will be affected, but they will have flu-like symptoms, etc. It's only the 5% which will become critical. Now, all the hospitals, I think, are full with symptomatic, most of the patients, very few that are critical, and some of them are positive who are asymptomatic also, who have been admitted and who have been isolated. But the biggest challenge now for us is to move on. And we have to move on, because if we don't open up, whether you want to do piecemeal or otherwise, for example, Dubai City, see the way that they have opened up. Dubai is opening up from tomorrow. I think we should do that, because otherwise people are going to come on the streets. This COVID anxiety is one of the illnesses that is cropping up. And it is cropping up not only amongst the jhoppadpattis or in the slums, but is cropping up with middle class, upper middle class, rich, everybody. So I think we need to do something, and we need to open up slowly and effectively.
Okay.
Now, if you want to contain somebody who is tested positive, be it, let it be contained. You can contain an apartment. Societies are going paranoid where they are not allowing the bhajiwala or the doodhwala. There are so many senior citizens who are living alone. How can they manage things? I think it is going way beyond, and everybody has become paranoid in its total psychosis. And I think the death rate, as one of the doctors said, must be not more than 5%. So I think we should not bother, and I think we should take the next steps, because economy is badly hit, and people, if they don't have money,
but Dr.
employers
Parker,
are paying everybody. They have paid for 1 month.
Dr. Parker, you know, a part of what you're saying, the fear and the paranoia that's also coming in, is also because of the fact that people don't know that if tomorrow they get infected, you know, what are the kind of medical facilities and services that may or may not be available. There is already a huge amount of apprehension when it comes to some of the existing facilities, the state of affairs inside, the kind of attention that's given. Many of the healthcare workers themselves, even in city of Mumbai, not just Mumbai, in many other places, themselves have had to go into quarantine. Hospitals have had to shut down because of that reason. So all of this also, you know, obviously plays on everybody's mind, perhaps, which is why they're becoming more and more cautious. But can we really say that Mumbai can afford to open up right now? We got 500 cases recorded in one single day. Now, I'm sure a lot of them will heal and be able to go back home within a week. But still, that is still a lot of stress and burden on the healthcare medical system in the city.
True, but who has created this paranoia? It is we ourselves, all of us, and that is why we have to open up piecemeal. If we don't open up piecemeal, I think things are going to get even worse. You can't have people who are not being employed, not being paid, cannot come out of the house for the next 3 months. I'm sorry, this is going to create a huge problem. We'll have a law and order problem. The police are tired, the paramedics are tired, the municipal working people are tired, the nurses are tired, the doctors are tired. I mean, to what extent are you going to stretch them? Someday, somewhere, you have to give a leeway, no? So, I'm not saying that the endemic areas which are very red spots, you don't open up those, but at least open the others. People can't go from one place to another. Groceries are not reachable. However, people might talk, practically groceries are not reachable to everybody. They have to make do with whatever the groceries are available. So that's not what a normal life is. Please try to understand. You have to lead a normal life.
Let me get in another panelist and ask them.
Somewhere leading a normal life. One more thing.
Let me get another panelist to respond to that.
What about the illnesses which are diabetes?
Yes.
I wanted to say about diabetes,
I was coming to that as well.
Disease, chemotherapy. Where are they going to go?
Correct, fair enough. I completely agree with you. Non-COVID patients, especially those, people with diabetes, people who need a daily dialysis, all of that has to be also factored in, and you need medical staff, medical facilities for that as well. So let me bring in Dr. Pinto and ask him if he agrees with what Dr. Parker is saying, or if you have a different view of what we need to do going forward for Mumbai, how we should prepare.
Paranoid looking at absolute numbers. I think the absolute number has always to be taken in context with the number of tests that one is doing. And if you look at the ratio of the number of tests that come positive to the number of tests that we're doing, it's somewhere around 6 to 7%, which is more or less similar to most parts in the country. So it's not a hugely increased number. The fact that Maharashtra is a very populated state, Mumbai is a very populous city, and therefore the more you test, that 7% is going to convert into large numbers. The second thing that we need to realize is that we are a city of extremes. Around 40% of the city lives in slums. The remainder, there's the other end of the spectrum where people do have the facility of quarantining themselves at home. I think we must move forward into thinking about quarantining individuals who turn positive and have the wherewithal to do that at home, to be able to do that. That would significantly reduce the load on the healthcare system. So to answer your question, you said people are afraid right now that if they do turn positive, where will they go? The answer to that is, honestly, eventually we will realize that a very small fraction of people who turn positive really need to be in a hospital. A vast majority of them should be able to quarantine themselves at home as long as they have the facility to do so. So the individuals who live in slums, the individuals who live in containment areas which have a high population density, those are the individuals ideally who, when they turn positive, should be in a quarantined area, because social distancing, being away from people, is extremely difficult to such individuals. It's also found that a lot of these individuals in slums share common toilets, for example. So how will you be able to allow them to continue living like that and yet ensure that they don't transmit? So I think that's one of the things that we need to consider. And most importantly, since we're talking about opening up of the lockdown, and I think I've said this before on the show as well, I think we really, really need to know the antibody status of people across the board. We need community testing to have a better hold on what the actual community transmission is. And if we, especially in these containment areas, if we start going door to door and we realize that a significant proportion of individuals have already been infected, which might be the case given the fact that a huge number of individuals will not have any symptoms. If we do realize that there is a significant proportion of individuals who have already been infected and have antibodies, these individuals could gradually be eased into the community. And maybe that's one way forward out of the lockdown.
Okay, all right. In fact, I just also want to highlight, what the central team, which was here in Mumbai, and they, by the way, made 2 visits within a span of 1 week, if I'm not mistaken. They were here around 16th of April, and they were here last couple of days again, interacting with BMC officials, the experts, government ministers, and top officials as well. And they have suggested increase in institutional quarantine. They've also said that we need more focused tests for slum areas, clean and hygienic public toilets in slum areas, that private clinics need to start as early as possible, to the point that we need more clinics and hospitals to start running as well, that there is a need to move slum dwellers who are using public toilet to then a quarantine facility. So that's largely the suggestions that they have made. Now, so let me go across to Dr. Nanda and ask her, Dr. Nanda, and I don't want to, again, none of us want to sit here and sound very alarming about what's happening in Mumbai, but we need to talk about just how prepared we should be in terms of healthcare facilities and what should be our focus and strategy here.
Yeah, Tanvi, I think some of the panelists have touched things, and I don't want to repeat them again. Being a public health person, I will definitely speak about a public health approach, and also suggest, India is a very large country. Each of the states are like, countries in Europe. So one size definitely does not fit all. So I think in Mumbai, knowing very well that, very large proportion of people live in very highly, the population density is very high. I will suggest very aggressive case finding at this point of time through contact tracing and isolation, quarantining, whoever is required. I will also focus on water and sanitation. We keep on talking about hand washing. And of course, and we should also know the plight of the slum dwellers who do not have access to clean water. So I think a lot of focus has to be providing the slum dwellers with regularly with water. And when I'm saying water tankers, I'm not saying, like a lip service. It has to be adequate. So that, otherwise, sometimes water, when it's provided, once in a day, then there will be so much of rush, and that itself can, people will not be able to, follow the social distancing that is being suggested. And same thing as toilets. And I'm just thinking, the central team definitely suggested about temporary toilets to be provided. But along with that, we all know that, the ratio is, very high in terms of in Mumbai slum areas. Also making sure sanitary workers are available to clean toilets. If there are too many people using the same toilets and it's, a lack of water, I think focus should be on how can we ensure the toilets are cleaned, and not that people are going and using dirty toilets. And just providing temporary toilets may not be the solution all the time. Then also the focus on the elderly, I think, is going to be very important. While during contact tracing, making sure that there aren't vulnerable and elderly people within the communities. I think it's very important. So I think a public health approach is going to be very strongly required in these slums. I have been looking at news and the pictures of people rushing to kind of markets for vegetable buying, and I have been thinking also, why can't it be regulated through why can't vendors be regulated by social distancing, following social distancing principles? Just like I saw something very interesting in Manipur, where they kind of made sure that vendors are not sticking together and sitting, so that people that come to buy also, they are not huddling in one place. Which I'm seeing in Mumbai happening through in the news channels, what I see from from the news channels. So I think these are some of the simple things that one can think of. Plan. Now, we cannot do anything right now. It's the slums are a given, but I think in future it is important for the urban planners to think that it is COVID-19, but there are other infectious diseases also, which kind of are, people become very vulnerable to them, like tuberculosis and all of that. So I think our urban planners have to think in the long run how to deal with this, slum situations, and how to kind of protect people not to be in such, congested areas.
Yes, and some problems are unique to cities like Mumbai, especially Mumbai, which is the problem of the kind of population and the population density and the lack of space. I mean, with roughly about 1.8 crore people, you have a population density of 20,600 people per square kilometer. Now, what kind of social distancing, and for how long will that social distancing, be maintained? Now, and people often ask me this question, Dr. Bansali, that even if we, say that, okay, some amount of movement can be allowed, or we should gradually start looking at getting back, how will that happen? Look at the number of people, the way we live in smaller places, sharing these rooms, when we travel in public transport, in trains, in buses, the way the local trains get crowded. What is going to be the long-term solution for Mumbai?
See, Tanvi, one thing we need to understand. One thing we need to understand that
Yes.
this is a totally different situation. This is not the situation like a flood or earthquake sort of. It's a different kind of situation. Whole world is facing this condition, and every day there are new challenges. Are there new guidelines we are making? As of now, lockdown is there. We need to follow the order of the lockdown. We need to respect the lockdown system and principles. I feel we should extend 2 more weeks this lockdown situation. Yes, we may allow in that non-containment zone. We may allow non-containment zone areas some sort of like bijli wala or repair wala, some sort of work like where we should not have more than 4 or 5 people. We should maintain physical distancing like local train. We may or may not start. If we start local train, then we should maintain physical distancing. And second thing that we need to understand that work from home culture, we have to adapt that culture. That maximum people should work, sit at home and do their work. But this is definitely new kind of challenge. As of now, we prepared very well for this kind of situation. India worked very well in this condition. You must have seen that earlier there was a shortage of PP kit, there was shortage of ventilator, there was shortage of quarantine center, shortage of critical care hospital. Now we have clear-cut guideline, clear-cut things are there. This is the COVID hospital, this is non-COVID hospital, this is a suspected case where we can put. And now government is acquiring this stadium, open grounds to make that quarantine center or some sort of isolation center. So I think every day there are new challenges are there, and we are ready to fight with these challenges. We are ready, and we all frontline warrior. We are all doctors, nurses, hospital staff, like municipal corporation staff. Everybody is ready, and we know there is that every day there are new things, new challenges. We have to fight with that, and see we have to live with this. We cannot say no. These are the situation. It's
Yes.
not flood. It's not earthquake. So we cannot move away. We have to fight, and I'm
Okay.
sure, I'm sure if we fight and if we all are together, we will win this battle.
Dr. Bansali, there is also another question, that I wanted to check with you. Now, in many cases, there are doctors and nurses who've tested positive. Those who came in contact with them have had to go into quarantine as well. So there is already a pressure on the existing staff at a time when you
Yes.
actually need more people, because more and more of these cases are actually coming out now. Is this a concern that the authorities are looking at? How do we resolve this problem?
Yeah, for this problem, we already giving advertisement. Like earlier, there was a lot of GPs who were not working. They were sitting at home only because all the lockdown was there, and still lockdown is there. But the GPs, the general practitioner doctor, they were sitting at home only because society doesn't allow them to work in the society premises or the other side outside area. So BMC is looking at that potential healthcare staff. And they want to acquire them. They want to put them in the hospital settings like Nair Hospital or Seven Hill Hospital. In our Bombay Hospital also, we acquire lot of that healthcare staff. So that way, there are a lot of doctors are there, nurses are there. We need to utilize them, and we planned in proper manner how to utilize this staff. Like earlier, there was a lab technician shortage of the lab technician was there. Dialysis machines are there, but dialysis technician was we were in shortage. But after that, we gave advertisement in the newspaper or that social media sort of. We want a technician like dialysis technician. They came forward, and now things are moving forward.
Okay, Dr. Pinto, is that something that needs to be focused on, especially when we are saying let's start the private clinics as well, let's restart some of the hospitals that had to that had to be shut down because the staff went into quarantine. Now, if we need to even treat non-COVID patients, that would require a lot many more healthcare workers.
So for the non-COVID healthcare issues, I think the key is, number one, providing adequate PPEs to all doctors so they feel secure in opening up their clinics again. I think a lot of doctors have moved on to telemedicine platforms, including myself, which gives people an access to your doctor through telemedicine and not necessarily come to a healthcare setting where you might put yourself at a higher risk and put others at risk as well. I think we need to have strict rules in terms of seeing patients only by appointment rather than having a horde of patients together. I think the number of people accompanying patients should be limited to one. I think a lot of measures will need to be hospitals, healthcare settings, dispensaries have to absolutely compulsorily be a mask area. Everyone has to wear a mask. I don't think that's negotiable. And I think that's true of the city in general. Even when we decide to open it out in a phased manner, I think masks are going to play a key role in controlling this epidemic, especially because, as you rightly pointed out, physical distancing is not something that's going to be easily doable. So I think if you're wearing a mask, and I think there's a lot of evidence now that masks definitely control the transmission of the infection to a certain degree, I think that's going to play an important role. And of course, periodic testing of healthcare workers as soon as they have symptoms. And this concept of universal preparedness. You assume that every patient entering your clinic is positive until proven otherwise, and you don the kind of PPEs that are necessary to deal with a situation like this, rather than realize that in hindsight, and then there's this whole contact tracing, and everyone has to really suddenly go about testing themselves. Instead, if you're prepared right from the word go, even if you do face an encounter with a patient who turns out to be positive, you realize that you've taken all the precautions and therefore you don't need to go over in terms of being concerned.
Okay, quick closing comments from Dr. Parker as well. I'm out of time, but very quickly, Dr. Parker, closing comments from you.
Closing comments are that I think we should open up wherever we can. I'm not talking about the red zones. I'm not talking about the containment areas in the slum, etc. You should let people move around. You should also open up the hospitals for the other illnesses. And I think we should not hype COVID-19 to such an extent that now it has become a paranoia. And I think life has to move on. So somewhere we have to start. I think we had locked ourselves for quite some time, and this is the time for us to slowly release all the pressures that are already ingrained in us, rather than having a law and order situation, rather than having the police, the paramedics, the municipal officers who are working day and night. As it is, they are overworked. I think they also should be given some air to breathe. That's my closing comment.
All right. Okay, all right. Thank you so much to all of our panelists and experts. Always a pleasure to have you on the show and give us your insights on the topic of discussion. Mumbai, right now, viewers, clearly is the city that with the highest number of cases on the rise, and it's unique because the challenges of crowded areas, crowded clusters, the slum areas, that challenge remains, and it's one of the biggest challenges. And like Dr. Nanda was also saying, that we have to focus on these areas, on providing them additional facilities and isolating them or quarantining them. We also have to ensure that they have enough help, medical help, food, money. People living in these crowded clusters, especially in the slums, are also those who get badly affected when the economic activity comes to a halt, like it has right now. So from all aspects, they have to be taken care of. And if we have to win this battle, we have to look at cities like Mumbai and now increasingly Chennai, Hyderabad, Delhi. These are the big centers with large number of cases for coronavirus. We're going to take a very short break. On the other side, we talk about plasma therapy, the pros and cons as we know it. How does it work? All the updates on the other side. Good evening, viewers. If you remember, a few days ago, we had a conversation about plasma therapy, and we had our experts explaining to us what exactly this is. At that point of time, the state of Kerala had sought permission from ICMR to carry out trials for plasma therapy. That process is still on in Kerala, but most states have also started to do it. In fact, as we speak, at least half a dozen states across the country are looking at using this option, this process to help COVID patients recover. So we decided that one more time we're going to talk about it, understand what the process is. Are there some concerns that one should keep in mind? What has been the response globally speaking? But before that, let me tell you that today the Delhi Chief Minister in fact came out and spoke about it, and he said that they have already started using this on patients, that they've actually used it on 4 different patients. 2 of them have nicely recovered as well already. So they found the donors to give the plasma, and then they used it on 4 COVID patients. Listen into what Arvind Kejriwal actually said.
जैसे मैंने कहा, अभी तक हमारे को लिमिटेड ट्रायल्स के परमिशन केंद्र सरकार से मिली थी। केंद्र सरकार ने हमें ये परमिशन दी थी कि आप केवल LNJP के सीरियस पेशेंट्स के ऊपर प्लाज्मा थेरेपी ट्राई करिए और हमें नतीजे बताइए, फिर हम आपको बाकी दिल्ली की परमिशन देंगे। तो अगले 2-3 दिन और हम ट्रायल्स करेंगे और उसके बाद नेक्स्ट वीक हम लोग केंद्र सरकार को पूरे दिल्ली के सीरियस कोरोना के पेशेंट्स को प्लाज्मा थेरेपी देने के लिए अप्लाई करेंगे कि पूरे दिल्ली के सीरियस पेशेंट्स को प्लाज्मा थेरेपी देने की हमें इजाज़त दी जाए। मुझे उम्मीद है कि वो भी इजाज़त हमें जल्दी मिल जाएगी, तो उसके बाद दिल्ली के किसी भी अस्पताल के अंदर कोई भी कोरोना का अगर सीरियस पेशेंट है उसको हम ट्राई कर पाएंगे, उसको हम प्लाज्मा थेरेपी दे पाएंगे।
Now, viewers, plasma therapy largely means that the antibodies are used from somebody who's recovered, somebody who's battled a disease, and their body has produced these antibodies to fight the infection. You take those antibodies and then you give it to a patient who may be struggling, whose own body and immunity may not be able to fight the infection, and you inject these antibodies. That's roughly the simple explanation, but we have experts, so I'm not going to go into the details. I will ask our experts to do that for us. Dr. Rakesh Mishra, good to have you back, Director for Center for Cellular and Molecular Biology, joining us from Hyderabad, and Dr. Om Srivastava, good to have you back as well, Director for Infectious Diseases at Jaslok Hospital and Research Center. Dr. Srivastava, let's begin with you. It's not a new concept, but obviously when it comes to coronavirus, we're only figuring this out now. Can you give us some insights into what has largely been the response to plasma therapy across the world?
So yes, it is something that that has shown good results, in that you need to be picking up the correct patient correctly. You need to make the right choices as to who is the patient who is going to benefit the most from this kind of therapy. When you do that, you're probably going to find very good outcomes. So you've got to time it correctly. You can't make it too premature because that's not going to help. You can't wait for a stage where nothing is going to matter at that stage. So you've got to time it correctly. Plasma therapy all over the world in selected patients has done very well. But look, this is early days. It's not the same thing. You cannot apply what worked in one infection is going to work in COVID. And so you need to have, so as you know, as you were just saying yourself a minute ago, it is the antibody, but it is not just the antibody. It is what's called the neutralizing antibody. That means the antibody in the patient's plasma, whose plasma you have collected, needs to be able to neutralize the virus. Unless it is able to do that, that antibody has no meaning, really no meaning. So we do what is called a titer. That means you find out what is the quantity of the antibody in the patient's plasma before you decide that this plasma is appropriate for being given to somebody, for another patient who is going through a life-threatening stage of the illness. Tanvi?
Okay, just to understand, if we have a set of donors, how many people can one donor help, with the plasma that's given from one person's body?
So there again, the total amount of plasma that you need to transfuse to somebody who is critically ill, that is a part of some amount of debate and disagreement all over the world. There are those authorities who would say that about 350 mils is sufficient. There are those who will say that about 450 mils is required on more than one occasion, sometimes two, sometimes three occasions. That part is still, various centers have shown their own results as to what would work best, and based on their results, they are now going to try and say that please, try and see if you can replicate this in your center. Ultimately, it's a matter of what is the physician, the clinician, the person who's going to set aside a protocol. It's what his or her perception is about what is going to work the best. So, in the protocols that we have written in one of the hospitals that I'm attached to, we are going to be saying between 400 and 450 mils of plasma on one occasion, and in patients who are responding slowly or who are critical, we might end up using it on more than one occasion. That means two occasions.
Okay, Dr. Mishra, one of the points that Dr. Srivastava raised was about when you use this tool, you do plasma therapy is also very important. When should one, the medical experts look at using it? At what point in the infection, or does it depend on how bad it is, or is it a reflection of how many days since you got exposed to the infection? Give us some insights.
Yeah, so as Dr. Srivastava mentioned that you have to choose the correct time window in which you have to give it to patient. If you choose when the patient, most organs have failed, then there is nothing going to happen. It cannot recover from the disaster that person is going through. Basically, what this plasma therapy does is it will suddenly neutralize the virus if you have taken the correct one, which means which has a good titer of neutralizing antibodies. Which means the antibodies that recognize the virus from its surface proteins. And if the antibodies again anything internal or which is intracellular, that's not going to have any effect, although that is good for test and other things. So if there is a good titer from the donor and you are giving before the too much damage is done, so what this will do is it will neutralize the virus, and then immune system of the person will get the push and tilt the situation in favor of the patient. If it is too early, then also there is not much point, because there is not enough virus roaming around, and they are not in the blood system, because this is going to neutralize largely what is there in the blood or in the accessible part of the body. So you need correct time and the correct titer of the antibody. These are severe limitations. It's not like any normal drug that whatever amount you want. You just heard that you need several hundred milliliters of this blood, and not many people can give. There are patients who have recovered if they are too young, too old, other restrictions of whatever blood donation restrictions are. So one has to be really very, very judicious about this.
Yes, in fact, I'm looking at the details that we've also got in Delhi. 4 patients at the LNGP hospital and 1 patient at a private hospital received the treatment, and they have showed improvement in their situation. In Gujarat, in fact, on 20th of April, in one of the Ahmedabad hospitals, they administered plasma of a donor into a patient. In Punjab, it's been attempted now. In Ludhiana, in Kerala, they are now working on these trials. In fact, we had the Kerala Health Minister yesterday speak to us in detail about it. But Dr. Srivastava, are there any risks involved, any concerns that we are watching out for?
So yes, there are, we quantify them based on those risks that may be mild or moderate or severe. There are a number of small mild reactions, like a small amount of giddiness, dizziness, some amount of headaches. That's because most of the times when you're doing this procedure, there is a little bit of citrate involved in the fluid that is going to be used. And so there are mild reactions that are to be expected, but they're mild and they're pretty much lasting a few minutes. In very rare situations, you might end up having more severe, more adverse reactions. But like any other therapy, Tanvi, you are going to need to balance it between the risk and the benefit. And the benefit in the correct patient is so humongous, it is so huge, that you would probably say that this amount of risk is acceptable and let us go ahead with the therapy. So there are risks, yes, like anything else that you are going to be using as treatment. But in the overall balance of the benefit and the risk, I think that this small amount of risk is acceptable in somebody who will benefit from this kind of therapy, which may be life-saving.
All right. Thank you so much to both of you for joining us and giving us these insights. As more and more, countries and states in our country and hospitals look at this option, one can only hope that that this brings about some help and helps lots of patients recover. A tool that can be used now that we have a large number of people who have recovered and who have these antibodies in their system. Thank you both, gentlemen, for joining us on this conversation. Welcome back. Viewers, you may have heard that Franklin Templeton Mutual Fund has decided and announced to wind up 6 of its fixed income debt schemes. Now, this is largely also happening because of the prevailing economic conditions in the country. But let me just try and decode this for you. And what does it mean for investors, not just for Franklin Templeton, but otherwise should the investors be concerned, those who are parking their money in mutual funds. As far as the Franklin Templeton investors for these 6 schemes is concerned, investment and redemption in the schemes will not be allowed. You can't switch out, you can't transfer your money, that won't be allowed. You will only get the proceeds once the time is done, and then that will be given to you by the fund house. But let me bring in an expert who can explain this to us. Gaurav Mashruwala joins us this evening. Thank you so much for speaking to us, Gaurav. Let's start by trying to understand what happens for the investors of these schemes, or in any scenario when a fund house makes such an announcement. What happens next?
Tanvi, as you rightly said, that these schemes are not wound up. It only means, and I'm going technical and I'll simplify it, is that an investor can't put in more money and he can't take out. As and when the fund house receives the proceeds from the bonds and debentures that they've invested, those will be distributed to investor in the proportion that they've invested after deducting any expenses there are. Number one. Number two, these were high risk category investments and schemes which are known. It's not that this has happened something overnight. The parameters, the attributes of these schemes are high risk, and that all the investors who have invested, either they or their advisors, were aware. I'm not defending the fund house, I'm just putting the facts that these schemes are not wound up. Money, you can't take it out, but as and when the fund house receives money in these schemes after selling the bonds or when it matures, investor will receive money back.
Okay. Should investors right now who've put their money in similar schemes or of other fund houses be worried? Is there a larger concern? Because obviously, what is being told to us is that this is to do with the prevailing economic conditions.
So yes, number one, this is happening with the prevailing economic condition where high risk bonds where there is more risk and where there is investment made by mutual fund schemes, those mutual fund schemes are not able to sell because there are no buyers. And hence, if investors go and ask for money, they will not be able to pay. Number one. As far as investors are concerned, they need to take a call, and maybe with the help of advisor, or if they've done it directly, as to they want to still stay in high risk category. High risk category will give you high returns, but they will have a high risk. Now, if that's not what you want, then please move out. But if you want high risk so that you get high return, then stay invested. So it can't be blanket yes or blanket no. Take a conscious decision that out of total investments, very small percentages what I've invested to get higher returns and I'm okay. Or this is not the kind of volatility or risk that I can afford to take. I have certain commitments and I need this money for emergency, contingency, or anything else. Then you are advised to come out of these schemes, which other fund houses would have a high risk bond category funds.
Okay, Gaurav, one question that plays on everybody's mind at such times is that, of course, when it comes to the debt schemes, they are high-risk schemes, and they're also high-return schemes. But should there be a concern that your money might get stuck at any point if the market conditions become really bad?
Absolutely, yes. That's the reality. So take a call. If you are investing in something that is high risk, you could be facing a problem. If you have invested saying that you want higher return, then live with it. If you have done it under either advice which is not appropriate or you are not aware, move out. For me to come here and say that, look, everything is hunky-dory is not appropriate, it's a call investor will have to take. It's like, if I can give a complete different analogy and just to explain, because again, we are talking to a lay investor, not the investor of a business channel. If you invested in mid and small cap equity funds which are high risk, you can make more money or you can lose. If you have put in index fund or large cap money, large cap funds, the returns are a little lesser, but the chances of losses are less. So it's an individual call.
Okay.
But now, at least if you have done that, go back to drawing board, talk to your advisor, and then take an appropriate decision.
Okay, always a pleasure to have you, Gaurav Mashruwala. Thank you so much for breaking that down for us and explaining to us. So it's not right now for the investors of Franklin Templeton, for those 6 debt schemes where the investors have put in their money, you will have to wait until the time is done for the fund house to return your money. You can't pull it out, redeem it, or invest any further into those schemes. Thank you so much for joining us, Gaurav.